The spread and impact of COVID-19 continues to bite harder within various sectors of economies, and vulnerable groups have not been left out. In a bid to upgrade data on vulnerable groups in Ghana to reflect the present status of the target beneficiaries for social protection programs amid the COVID-19 pandemic, the Ghana National Household Registry is rolling out an upgraded plan on household registration to enable them collate data on vulnerable groups. According to a report by Global Partnership for Education, in the short term, the widespread closure of schools affects 91% of the world's student population, cuts children off from the vital services and protection that schools provide. The most vulnerable children from the poorest families will be most likely to have their health, nutrition and well-being impacted, their learning stopped and their safety at risk because their school has closed. In the long term, Oxfam also estimates that 500 million more people may be pushed into poverty as economies lose jobs, small businesses shut down, and safety nets are lost in the wake of the COVID pandemic. The economic shock is likely to reduce education spending further, putting pressure on households to meet the growing financial gaps. Compounding these hardships, growing public fear and misinformation may fuel discrimination, stigma, and intolerance. The ability to mitigate these impacts relies heavily on the ability of civil society to maintain its role and give voice to communities most likely to be left behind in the public emergency response. However, the national coordinator of the Ghana National Household Registry, Dr. Prosperlari, says his outfit is rolling out interventions to address this.
From 2015, one of the aims of the project was to sweep across the poorest regions in the country, and for that matter with the all 10 regions according to the Ghana Statistical Service poverty profile, then it meant that Upper West being the poorest, followed by Upper East and the Northern region were the three regions that were targeted for a census approach to be used. Census in that every household was eligible to be profiled in it.
According to him, the agency would adopt the census approach, employing enumerators who would visit various households and use a well-structured data intake questionnaire to collect socio-economic data on members.
Data on the poor is so transient and not static. It's so dynamic, keep changing. So even when we had this COVID-19 pandemic, it became so clear that the urban poor cannot be disregarded, much as we were sweeping the poorest areas before we come to the very urbanized areas. We therefore did our emergency data collection in the Greater Accra region, looking at the hotspot areas to be able to capture some vulnerable groups.
Send Ghana, a civil society group, believes availability of data on specific groups will help in addressing the inequality gap.
We have a duty to ensure that our advocacy continues, especially to speak for the vulnerable groups who may not be targeted per government-owned intervention, to draw government attention to the plight of such people, such that government can reorient its social assistance program to meet the needs and aspirations of such people.
George Osei-Bimpe further hopes that social protection policies will be factored in the manifestos of the various political parties.
Our expectation from the political parties is that, having had opportunity to listen to the citizens through the report that we submitted to them, they should fashion a manifesto. They should develop a manifesto that addresses the concerns as expressed by the citizens. So we are expecting that for the first time they should propose policies that respond to citizens rather than what they think citizens need. And that is the essence of the engagement that we have had with the political party.
The GNHR data collection exercise, which is being sponsored by the World Bank and Department of International Development, United Kingdom, since its establishment in 2015, has successfully completed data collection in the Upper West and Upper East regions, which were among the poorest regions in Ghana. The two regions presently had comprehensive data on the poor and vulnerable, which could be used to identify beneficiaries for social protection interventions and to provide relief services during an emergency like the current COVID-19 pandemic.